introduce my co-authors, of course. So it's Robert Stegwee, he's from Capgemini and also a professor at our university. And Patrick Janssen is also a senior consultant from Capgemini. And together we built these 4 case story that I'm about to tell you. First, business modeling, what is it? Martin already told something about it, so I will skip some of the slides, so I won't talk about Osterwalder anymore. Martin already showed the picture. But like I said, some people think business modeling is only about the financial situation, so they act more like business cases. Some people think it's analyzing the whole process, everything about the process. I would call that business process modeling. In between there is something called business modeling, but what is it? I will tell something about it later. Then we have, I will show the conceptual model, and I will show 4 cases very shortly, given the time, and I will end up with some conclusions. So I talked about 4 possibilities. So we can enhance, we can extend, we can expand the other way, or we can exit. And that's the 4 possibilities that we really have. And John Ward showed me the picture, and I took it from Linda Applegate from the book Corporate Information Systems. So if I want to tell what is business modeling, I think it's getting all these 4 things into perspective. So what do I want to do with my innovation? I have to keep up here, otherwise I will look at the different things. So Martin already showed the Osterwalder model. We took it as a basis, but we tried to figure out what extensions does it need to make it a more valuable model. I think in practice you can use it very well. So it's very nice to put up the stickers and to make these managers think about their value proposition. But there has to be something more than that. So we took also the Stoff model, and I actually presented this Stoff model in Egypt at a conference in Cairo. And I thought it was very appropriate, because Stoff in Dutch, it means dust. And you've got a lot of dust there in Cairo. So the Stoff model stands for services, technology, organization, and financial, of course. But we extended it a little bit to a dynamic Stoff model with Björn Keil together. And I also put in the environment, because I think the Osterwalder model is not good in showing the environment in total. And there is much more to say about the environment. So we took the well-known literature from Porter and from Winsberg and from all these management gurus, and took that into the environmental around the Osterwalder model. And finally, I think an effort analysis is very important, and not effort in the sense of costs, because costs are always analyzed enough. No, it's effort in the sense of capability. It's effort in the sense of the time you spend, the time people have to spend, the users have to spend to get this innovation going, and that's often overlooked. So here we have an example of the dynamic Stoff model, and this example was made by one of my students for a diabetic serious game that she built. And I only show it as an example, so I will go through it very quickly. But you have to look at the technology of serious gaming, and especially how you can make it look good. It's always, they talk about usefulness, people, but I also talk about the fun of these things. So if you're working with a website that doesn't look good, yeah, you're not bound to use it very well. So it has to look good. It has to be serious fun. So IT, of course, in the environmental layer. Then we have the organization layer on the other side. We would have less management. Then we have the context on the other side. We have, I have to put up here too. We have finance, of course, to take care of who's going to pay for it. Is the insurance going to pay for it, or are the patients themselves going to pay for it, which is not common in the Netherlands. And on the upper side, the service is serious fun, and we bring it to the market in the end. And don't forget the arrows, because this thing is moving. It's not a status quo that you can put up like, okay, now I'm predicting the future for 2020, like I saw the pictures going in the first presentation from our Belgian, and I kind of dislike the pictures, sorry, but because you cannot say something about 2020 now. So things can be disruptive. They can change suddenly and go up and down in another way as you pre-tell it. So you always have to look again and again and again and turn it around. Well, cases then. We asked our students to take successful e-health application in the Netherlands and go interview the people that made it, that work with it, and that think it's worthwhile. And the first example, I have plenty of time, I thought, so why are you asking? The first example is the Taylor baby case. Ronald Spanjes is one of the founders of that ID. Just a very simple ID. You are a newborn parent, and your baby is in the intensive care, and you don't want to leave there. You just want to stay there and see that it's breathing and see that it's alive. But yeah, sometimes the baby has to stay for 3 months, 4 months. So you cannot stay, and then it's a very simple way to put up a webcam there and always have your baby in the pocket and see that it moves. So it's a very easy value proposition here. It's high value, low cost, low effort, and it's implemented well, and it works fantastically in most of the hospitals in the Netherlands without any problem. And nobody has resistance against this kind of system. No doctor has resistance. No parents have resistance. But we have to classify it as unanticipated. And that's something important in this slide. So it's unanticipated. The parents, they don't ask for a video connection with their kids. They're happily that it's taken care of. So you have to, as a researcher or as a designer, you have to invent it and say, you've got a need to have the baby in your pocket. So that's not a need that is expressed by the parents or by the users themselves. So that's important of this case. Then we have Telefysiek. It's a different story. They have physicians making a movie of children moving and share that movie with another physician to say, well, I've seen that before. It's not working well in that area. And then one moving image says more than 1,000 words. So the other physician says, yeah, you have to treat it like this. And this system is also quite easy. We took it from the organizational literature. We took the stable